This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, so this is kind of a quick and interesting little study that looked at the degree of fever in adults and mortality rates. So, there used to be a lot of talk about this in pediatric patients before vaccines. Higher fever meant potentially more bacteremia and a bigger deal. We don't think about it quite as much in adults. There hasn't been a lot of studies looking at it. So this study looked at, a large database of an EHR system, actually in Israel, and then compared their patients with fevers to the death registry. So had a pretty good idea of what the mortality rates were when they looked back. And they had about 20,000 patients who they looked at who were admitted with fevers. And overall, the death rates for adults with fevers was pretty high, like 12% at 30 days. So that's just kind of interesting overall. But then when they looked at the actual what the temperature was, and then, was there a difference? Is a higher fever worse for mortality? It was fairly level until you got to a pretty high fever of about 40 degrees, which is about 104 Fahrenheit. And then, up until 104, it was still pretty high, about, 10% mortality. But once they got to that really high fever over 40 degrees, it went up to like 24%. So in this study, fairly large database study, when the temperature got really high, patients did worse, had higher mortality, more ICU needs, more renal failure. So just kind of something interesting, if we're admitting somebody and their fever is really high, maybe pay a little more attention. Those people might actually do a little worse. Any questions? Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.